Morning, everybody. Welcome to another edition of Tech Tuesday. I usually have Tech Tuesday, but I decided that we're going to mix it up a little bit. And because this is something that's on everybody's mind, and that's our health. And we have been blessed to be with EXP, and EXP now has benefits, health and welfare benefits. And I know there's a few other companies that are out there providing that. But I think we've coined the market and really have the best of the best. And I can't think of a better person to talk about this than to Margo Wickersham. And the reason is because her and I have developed a relationship over the last couple of years. We always run into each other at major events, and she has been so cordial, treating me with kindness and dignity and respect. And I return the favor with her and her hubby Coleman, and I love them both. But Margo, I'm gonna let you just take it away, ask you some questions, and let's get going.
Let's do it.
Okay. So Margo, tell me what your role is and what are you responsible for?
My title is Strategic Vice President of Senior Vice President of Strategic Partnerships. I am in charge of the relationship between EXP and Clearwater. I work for Clearwater Benefits, and we are the partner since 2019, delivering healthcare to agents, EXP agents in the U.S.
This is a big deal.
Big job.
Yeah, I've noticed that other companies have kind of followed suit, but tell me specifically about the benefits of merging EXP with Clearwater.
The primary benefit is that by really embedding Clearwater into the business, then we become much more in sync to be able to collaborate for agent retention, for agent attraction. And my workplace chat is constant every day. I hear from individual agents who have questions and they're not sure where to go, or I hear from agents who want to schedule podcasts and meetings like this, to people who are administrative assistants in states who want to schedule presentations with updates about healthcare to states. So all the questions, I seem to be the go-to person, and it makes it easier because I have an EXP Realty email address. I have a login for the world. I have a login for workplace. So I'm in the business, and so are several of my colleagues, so that we can do the best job to serve and support EXP agents.
Yeah, in my experience, I haven't found very many real estate companies that offer benefits. And so if a real estate agent wants to get benefits, normally they can get them through their MLS because there is some type of relationship. But, quite frankly, I know people who are agents that had to go out and get a part-time job or a full-time job just to get benefits because it's so darn expensive.
It is. And of course, the short explanation for why that is because benefits have been traditionally delivered through employer sponsored plans. That's how you get access to group plans. Group plans have the best rates and the best benefits. So by definition, if you are self-employed, you're a 1099, a contractor, you own a business, you don't have access to some of the best plans, which is sad because this is the backbone of our economy. Small business runs this country.
Right.
So what the founders of Clearwater realized was there was an opportunity to find a way to deliver better benefits at lower rates to self-employed people. And innovation and health insurance aren't usually two words you hear in the same sentence, but our co-founders are very innovative, like a little mini Glenn is how I think of Jason Sherman, and that he found a way using technology and some other smarts to create plans that do deliver high value for a lower cost, And we just keep innovating. We keep adding more and more plans to the mix so that we're continuing to add more and more value, because it changes every single year. It's not going to get better. And agents continue to need to have access to the healthcare. And so we have a suite of products that we deliver. We have a suite of services that we deliver, which include checking out our website. It's dedicated expagent.healthcare.com. And we also have a team of consultants who are outstanding. And they're very compassionate, very empathetic, and like to have one-on-one Zoom calls with agents to find out what the best plans are going to be to fit them, so that agents don't have to become subject matter experts in insurance. Who wants to do that if that's not going to be your primary business?
Right.
So that those resources are so helpful, because in addition to that, it's hard to find something that is cost effective and it doesn't cost a mint, and that has good benefits. It's also super confusing. I mean, what word would you describe for shopping for health insurance?
Overwhelming.
Mm-hmm. No, I ask this in almost every presentation, and never once has anybody said, great, amazing, rewarding. So we enjoy taking the sting out of that process. And because it is overwhelming and confusing and unpleasant, even though it's important, people have a tendency to put it off, even though they know it's important. And there's a lot of agents who have decided, this is so expensive, I'm just not going to even pay for, I'm self-insured basically, or as I like to call it, the GoFundMe plan. And so we know that about 30% of agents are uninsured. And we'd like to
Yes.
bring that number to single digits very quickly. I just typed in the chat the link
Thank you.
that people can share if they want to book a call. And I'll share that other link, which was to the website that I mentioned.
Yeah. And also, if you can put your phone number in there, that'd be great too.
Yeah, I will do that.
Now, while you're doing that, I'm going to test you a little bit. I'm
Test
not
me.
going to hit you too hard, but you know, wow, 30% of agents do not have benefits. I can't imagine how something tragic happens in their lives and they have to go to the hospital and they have to pay for it. That would wipe them out. I mean, wipe them out. And I don't care how many houses you sell, you know, just one trip to the ERs could be 20, 30, 40, $50,000. And especially if you have an average of 2 kids in your family, blah, blah, blah. So what I want to ask you is, can you just do a testimonial of someone comparing, in other words, no insurance to some insurance, and what Clearwater has to offer? If I can ask that without not taking a deep dive.
Right, exactly. No one wants to really see how the sausage is made anyway.
Yeah.
So I'm not going to go into the details of the plans. The way I describe it is we have a wide variety of plans. And so we help select which ones make the most sense. So I won't go into the details about those. They're mind-numbingly boring details for most people anyway. But let's take I've got 2 or 3 that I'll share with you. So one is extremely dramatic. This is Terry Hooker, who's an EXP agent who had the Delta bad version of COVID in 2021. They gave him a 3% chance of living. So his consultant at Clearwater and I actually enrolled him 3 years ago myself. We were staying in touch and trying to, how do you ask, how's he doing when they said he's got a 3% chance of living? Anyway, we followed him. They put him in a coma. They induced a coma so that they could help his lungs collapsed. He was on every kind of tube you can imagine. They just didn't think he'd make it. And so he was in a coma. Then he was in ICU for months. And then he was in the hospital the entire year. So he's alive today. He came to shareholders and we cried when we saw each other as shareholders. I was so relieved to see it, so happy. So what do you think that cost total? A year in the hospital for all of that?
How long was he in the hospital?
A year. I mean, yeah, it's like monopoly money, right?
I would say over a million, 2 million.
$2 million. $2 million. That's like a heart, that's a transplant. That's the cost of a transplant. It's crazy. So he has one of the most popular plans, and he has I think it's a $2,500 deductible. He paid that amount. The plan paid the rest.
Get out. Get out.
Now, on top of that, the best news about this whole story, Frank, is that he made it. And the second thing is he made it and he didn't have to deal with financial struggle, even though he was a successful realtor and he has an organization. The third, the icing on the cake with the cherry on top, is that because of the EXP model, he had a 6-figure income that whole time that he was in a coma, he was in ICU, wasn't even awake, that provided for his family. It's just the best story ever. Yeah.
Well, number one, thank God he made it. Art,
Right.
So without going into detail, could you be very vague like a psychiatrist and kind of give a ballpark of what he was paying in his plan?
Let me think about that for a second. It depends on age. I'm trying to remember how many people he had on his plan. I mean, he's less than $1,000
A month.
so probably between $600 and $800 a month, plus or minus, depending on a couple of things. I know there are choices you can make about, do you want more bells and whistles? There are choices you can make about how low do you want your deductible to be. So those things are toggles that affect it, but it's under $1,000 for the family.
Wow. Sorry, that's my phone that's going off if you hear it. So let me try to get rid of it.
Individuals can get a plan for, I mean, around 300 a month. So it just
Oh my
depends.
goodness. I hear people without insurance paying $1,900 a month for a family.
Yeah. And, so what we see are things like this, Frank. The world is just topsy-turvy as far as health insurance goes. All the time I see and talk to agents who are their spouse is a teacher. And so teacher insurance is state sponsored, so can be good. It's not as good as it used to be. And that might be a good deal for the employee. And
Right.
it's so expensive to add the family that even though you're only paying incrementally for the family, Clearwater can still beat that to cover the family and sometimes even the employee. So it just depends. And we're crafty and creative about how we'll look at things so that it's not cookie cutter. We don't just go, a family is this plan. We might go, that makes more sense to keep the employee on that plan, but to put the family on something else and split it up. So we're very, very consultative with how we recommend the solutions for people.
Wow, $2 million operation that cost him $2,500. Whew.
I know. What's that, 0.5% or 1%? I don't even know.
That's a mic drop moment. That's for sure.
It is. It is.
Now, do you also cover vision and dental?
Yeah, so that's part of the toggling, because if you want to add vision, you can. If you want to add dental, you can. If you want to add critical illness and accident policies that pay a lump sum when those events happen, you can get those as well. Can you get just dental? Let's say you have an amazing plan. Let's say you're on TRICARE, which is the best military. First of all, thank you for your service. And second of all, nobody beats TRICARE. We won't try because there's nothing that does. So then we would say if TRICARE is what that person is on, and let's say they want dental, we can just enroll them in dental or vision, both. So everything's a la carte.
Okay. So I would assume, and I hate to assume, but with your company associated with EXP, everything's evolving daily. Can you tell us some highlights that are coming down the road to look forward to?
Yeah, super excited about bringing some mental and emotional health care to our plans. This is really, it's hard to do. Anybody who's ever tried to find a therapist, a counselor, a psychiatrist knows it's impossible to find them nearly that are on a plan of any kind. So you just pay out of pocket. And then you're like, well, that's given me more stress. I'm trying to figure out a way to deal with my stress. And it becomes this vicious cycle. So
Right.
I love that we have partnered with Talkspace. Talkspace is a virtual counseling, therapy, and psychiatry platform. And it allows each member in a household who's enrolled in one of the Clearwater plans, who's over 13, a free therapy session for 30 minutes or more per month, no cost, unlimited additional therapy sessions for $65 copay. And you can you do answer questions to be able to narrow down what areas you want to focus on, what particular issues are you wrestling with, so that they pick the best therapist for you. And if you don't vibe with them, that's fine too. You can just keep looking. So I love that. And also in the app, there's a chat feature. So there is available in between sessions some asynchronous support, which I think that is just amazing. So I love that is baked into the packages right now. We've worked on that for a year to find somebody. Nothing's perfect, but we're just so happy to be able to bring something to the table.
And especially in these times of,
Yeah.
you hear so much about mental illness in the world, and
Mhm.
parents are struggling to find people to talk to their kids, and they don't know how to deal with it. So
Right.
that's almost as big as mic drop as the gentleman that had the $2 million operation.
I know, it's great. And then, so for parents of college age kids, or, divorced parents who've got kids that are back and forth in different areas, just scheduling a counselor can be really almost impossible. So for my kids, I'm in Texas. I got one in Philadelphia. I have one in Fort Collins, Colorado. Everybody's on the plan. Everybody can have somebody, and it's all virtual. So we don't have the world's most complicated scheduling issues only when they're in town or only when they're up there. And that helps make it easier too. It needs to be easier. And I'm so glad that we're able to bring a valuable solution like this.
Yeah, that was definitely worth the call this morning. That is really cool. So, I have known that when in the past, when I was young like you, when I would call insurance people, you get bounced around and bounced around. Excuse me. When somebody calls you, are you the one that actually does it, or do you transfer someone to a specialist, or how does it work?
Yeah, that's a great question. So in the beginning, way back 3 years ago, I was one of the consultants, and I would be, and I enrolled Terry Hooker, as I mentioned, the $2 million success story. Now I'm not in that role anymore. I do more of this. I am out building awareness and educating people on what's available throughout the company. And we have a team of consultants. So people can reach out to me, and then what I'm going to do is share with them the link to book a call with one of the consultants, or they can go directly to that link and reach them that way. And the consultants are great about helping navigate the options, help people do a side-by-side comparison. For example, if they've got a plan they're on right now and they want to evaluate how does this stack up, they're great about doing that. And because there's a broader array of plans available now than there were 6 months ago, that is a very helpful tool to have access to those consultants. Then once they're enrolled, that's their consultant. And then we have a team dedicated to support and service. And we've grown so much in the last year or so. And so we have more people on the support team than ever to handle inquiries by text, email, and also phone. And there's a little chat on the website as well to help answer questions. And then if somebody gets tangled up, if an agent gets tangled up, they have a problem, they're trying to figure out how to get an answer and they can't, they just come to me. So they'll find me, and either they text me directly, call me directly, or find me on Workplace, and then I'll connect them with the people who can get things done for them and make it happen. But we try to give it a white glove. It's a very relationship oriented business. So is real estate, and our companies are both very collaborative, very agent centric. And how can we make this work is the primary modus operandi. That's not my job, that's their job. It is about how can we find a solution?
Okay, well, in kind of closing, I want to wrap up with two things. Number one, if you're looking at this Zoom call and you want to get a hold of Margo, please tell her that you saw her on my Zoom, because flattery will get you everywhere, number one. And
Yes.
number two, I am so excited about the recent announcement with our company, EXP, merging with a company called Viome. And it's the first time I've ever heard of a real estate company partnering with a health corporation, which this all kind of fits in.
Mhm,
I can't tell you how excited I am about this.
mhm.
Um, that really a company is going to help you become healthier so you don't have problems down the road or maybe headed off the pass. So, I don't know if you've had any experience with Viome. I don't know if you've had a brief overview, but this is pretty exciting from everybody's standpoint.
Absolutely. I had the opportunity to meet with the Viome folks who were at EXPCon. And so we've talked about what we can do together as well. And we are very excited as in addition to what you're talking about, prevention is, we all know intellectually that prevention is so
Yep.
much more powerful.
Yep.
And I think part of what is so fascinating about the Viome company and what they're doing is they're two things really stand out to me. One is that they're taking leading edge technology and healthcare, the kind of tests that they offer, they're making them available to basically the masses. This used to be it was only available for people who could shell out $15,000, right? And
Yep.
that's a very few number of people. And
Yep.
now, the price is like, what is it, $200 or something? It's not very much money. It's attainable. And the fact that it's focusing so much on gut health, and we've learned more and more and more as gut health is an
Yep.
indicator of so many things that
Yep.
just keeps coming up. So it's the leading edge on health indicators, and not just the standard. We all know to eat more vegetables and drink more water. We know that. We know not to smoke. We know to exercise, run around a little bit, get enough sleep. We all know the basics. So if we're living what we think is a healthy lifestyle, good. Okay, so great. We're doing these things right. Check, 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 check. But what we might not know is that inflammation is happening. Inflammation isn't good for our bodies. Other things can be happening. I don't pretend to know very much about this, but that Viome set of tests, and then the supplements and the whole program, and then remeasuring to help find out how your body is doing, is amazing because it's so customized to each individual. And that hasn't been available before to
Yeah.
individuals at a reasonable price. So it's game changing. And I mean, the stories like with Glenn, what was I think he is 64, and that was his biological age to start with, and now it's crazy like 48 or something like that.
Yes. Yeah, I am so pleased with Glenn Sanford and Debbie Berry, who's championing this campaign on. It's $169.50 a month, and that includes your test kit, which is amazing.
Yeah, it's
So
amazing.
when I first heard about these tests, they were tons of money.
So much
So
money. Yeah.
I'm so glad. Margo, we're gonna wrap up. Thank you for your time. I can't thank you enough. This call was better than I even planned, to be honest with you.
Wow. I
Yeah,
love that.
yeah. And thank you, Chris, for monitoring all this. And once again, can you just tell everybody that doesn't read chats what your phone number is?
Yep. 512-917-9284.
512, is that Texas?
It is Austin, Texas.
Austin, Texas. Very
Yeah.
good. Margo, my love to you, my love to Coleman, and we will see you very soon.
Sounds great. Right back at you. Thanks for having me.
Bye.